Hello, I'm Melissa Galloway. I'm a BSN student of American Sentinel School of Nursing at Post University. This is for SIM 436, Interprofessional Communication Health Assessment Tool. The discussion topic for the presentation is a description of a healthcare education tool for a specific health need of a specific population that is different from my own. The target population is a low-income minority teens with mental illness, such as depression, Asperger's, or anxiety. One difference in the target population for myself is that I'm not a minority race. I do not suffer from mental illness. My socioeconomic status would be that of the middle class. And lastly, there's a large generational gap between the teens and myself, who was born in the 70s. One study, Ethnic and Gender Disparities in Needed Adolescent Mental Health Care, included African Americans, Hispanics, and white high school students. It was found that 1/2 of the minority adolescents were not receiving the needed care for their psychological problems. In the same study, it was noted that low-income minority families are less likely to be insured. Therefore, they may have less access to care. During the year 2020, teen depression spiked by quarantine from friends, school, and outings. Teens who may have been getting treatment likely experienced canceled appointments prior to the use of telehealth visits being utilized. Special learning challenges from this group of people may be low reading literacy, lack of interest in learning, isolating, and lack of time due to working to help with the family needs. In the previously mentioned study, it was found that minorities are more likely to see non-clinical care for their depression, such as through church, family members, or community mentors. And the tool and how it contributes to critical thinking and literature. Literature shows that 80% of depressed teens do not seek the help that they need. And that's from Garrido and his group in 2019. Teens do not want to associate with the stigma of accessing mental health. They would rather have access to care under anonymity. To increase the number of teens who seek help with their mental health needs, we will review the use of a smartphone app as an intervention to help teens with mental health problems. The app will also work on an iPad, Android products, and laptop computers. Literature shows that teens prefer simple apps with minimal text that's easy to access and understand. That's also from Garrido and his group. Details of the health tool. The tool contributes to critical thinking as it incorporates Youth Risk Behavior Survey. The Youth Risk Behavior Survey surveillance was developed in 1990 to determine the prevalence of health behaviors in youth that are usual predecessors to death, disability, and social problems in youth in the United States. This questionnaire will provide needed information from the teen to the provider, and the teen may provide more truthful answers to these direct questions in an app versus person-to-person interaction. It asks the teen about safety, violence-related behaviors, smoking, vaping, drugs, and alcohol, and it has 5 specific questions related to depression and suicidal ideations. And I got that from the Centers for Disease Control Prevention 2020. The tool will also allow the teen to schedule an appointment with a counselor or practitioner, which the visit can be virtual through the app or in person. The teen would have anytime text help through this app. They could send an instant message through the app to a helpline where counselors would respond to their needs. The teens could be assigned a caseworker that would periodically check in on the teen through the app informally by texting or instant messaging them. There could be virtual support groups where the teens could use the app to join in groups with similar issues or people who have had outcomes with similar issues in the past. The tool contributes to nursing practice and patient outcomes by gathering information that's needed to know what interventions need to be implemented to assist the teen with their needs. The tool helps the outcomes of low-income minority teens as it provides them with instant access to care, where without the app, they may never seek clinical assistance. Interventions into depression will provide the teen with outlets and support versus staying in isolation and getting deeper into depression. The impact of technology on nursing practice and patient outcomes. To begin to describe the impact of technology on nursing practice, I would like to speak of nursing practice in a hospital floor setting prior to technology. Papers, and more papers to flip through, read, sometimes pick them from the floor from flipping out of the chart. It was time-consuming reconciling the orders from the beginning of the hospital stay to your current shift. Having an error with the reconciliation of an orders were a great risk. Charting the care was time-consuming, as it often was just a blank narrative to document on, which meant less face-to-face time with your patients. Communication between departments was difficult. There's not much that has not been affected in nursing by technology or informatics. One impact on nursing practice will be time saving on charting. Many records are checkboxes where the nurse is not writing out all the assessments. There's simple one click. Collaboration of care has improved with technology as teams can meet on a virtual platform. The use of email and instant messaging are also useful for this. Technology has reduced the number of errors made by the nurse with medication reconciliation, and an example of this is with our medical record system. We removed all the abbreviation for medication doses that were found in research to be easily misinterpreted. Telehealth medicine has grown substantially throughout the pandemic. Nurses utilize many forms of informatics such as technology, tablet technology, smartphones, and YouTube. And that is from our book, Rubin and Schaefer, 2015. Patient outcomes have been impacted by technology or informatics as reports are inclusive of 100% of the charts, and they're real time for outcome measures, allowing a team to change processes or provide additional training real time versus waiting for the next set of chart audits to be completed where only a sampling of the charts were reviewed, not always bringing the issue to the surface. Most electronic medical records can produce a report in milliseconds that would take a team of 2 or 3 people several hours to compute. Another impact on patient outcomes will be the reduction of safety-related issues that the electronic medical record prevents. In a handwritten chart, medication dose may be interpreted as 5 milligrams by one nurse, 2 milligrams by the next. In conclusion, with technology, we can reach our depressed teens in the minority that have reduced access to care. Giving this group access to care will improve the outcomes and reduce the risk of further occurrences of bouts of depression. The app will allow them to access care without all of their peers knowing. Just as technology could have a positive impact on teens, it has had an impact on nursing care in many ways. Thank you.